Hello beautiful people. So right now I'm on my attachment at the pediatric ward, and dealing with kids is just totally different and a totally new experience rather than with adults. Remember, with kids they're dependent, and so you get that confidence to help them and you get that attachment with them. So with pediatric ward it has been fun so far, because for kids, remember, just like being with any other kid, when you're the kid in a room, like, you feel it is so fun just talking to them and just trying to care for them just makes you feel emotionally okay. Yeah, but for adults, remember, yes, I haven't, not that it is difficult to deal with adults or adults have problem, but there's just something. Let me give you an example. Like for us in the medical ward in Muranga, the male medical ward is usually like almost 60% full with patients with alcohol withdrawal. Remember, in Muranga, I don't know, it is one of the biggest places where they just brew alcohol. So you can imagine this kind of patients, they are just so rude and cruel, and they have a little bit of psychosis or something. So you can imagine dealing with this kind of patients. You are always shouting, you're just always in a bad mood and angry, and they're always just trying to just make you feel bad by the way. And even some of them go to an extent of even trying to beat you up. I've just seen, like, I think 3 nurses. By the time I was in that ward, I saw 3 nurses being beaten up until you just have swellings in your eyes and such kind of thing. So dealing with the kids is a little bit more, let me say, peaceful, and it is just so nice. By the way, it is a nice experience. So for pediatric ward, for the time being, yes, it is nice dealing with the kids. You'll feel the fun, you'll feel like the joy and such kind of things. But there's also this other side of the negative one, because remember, these are just not like any other normal kid who'll just come and you sit together and you can just play and do that kind of thing. This child has come here because they have a medical condition. So some of them are usually in a really bad condition, and this is just so devastating. And even some of them pass away, and it is so heartbreaking to see a child who is 1 year, 2 year old passing away. It is so sad, and that is the only bad part about being there. But whenever you feel like the baby has received medical care and he or she is now okay and can go home happy, that is just one of the best feeling. Because the parents who usually come to the pediatric ward, mostly the mothers, it is just, I don't know how they change, because when you're in the maternity or in the maternal child clinic, the mothers are usually just so rude and that kind of thing. But in the pediatric ward, I usually feel like the mothers become so vulnerable, because having a sick child is so devastating, because you know that, not in a bad way, but there are chances of a child passing away or getting even worse. So they're usually so vulnerable, and they end up being so polite. So whenever the child gets okay and they go back home, they usually treat you like you've saved a life or something, or you've just done something so big, and they're so appreciative. They thank you and they like tell you nice words and such kind of things. So being in pediatric ward is just so amazing, because as a human, you usually want a place where you feel appreciated, a place where you feel like you are really doing something, and a place where you feel an emotional attachment to. And for me, I think that is in pediatric or in the maternal clinic. And I think maybe one day, if I'd want to find a place where I'd work, maybe I'll work at the maternal clinic or maternity, or even in the pediatric ward, because all the other wards, it's a no for me. So for pediatric ward, that is just it. And you have to, there are things that you have to be there. There's a kind of way you have to behave, because you're just not dealing with an adult. For an adult, sometimes you just get the medication, and even if they're stubborn, you just give the medication and you go away. But remember, for a child, you just can't come with that big injection and just expect to give them medication, and you expect them to like look at you and just be quiet. They're going to cry like hell. So in the pediatric ward, you just need to be so friendly and so calm, and you just have to bring that face of showing that you're not a bad person. Because for kids, they usually, I don't know how, but they usually know if you are this kind of a person who looks angry and is going to like hurt them. They usually know. So you just have to bring that friendly face. Like whenever you're giving the medication, you just come and try and talk them into it. You just come and try and convince them that the injection is not going to hurt, and that it is not even medication in the first place, that we're just giving water or something. So you just have to convince them into such kind of things. Because yes, it is okay, because you're treating them, it is okay for them to cry, but remember the kind of trauma you're going to bring into this child. Because most of the time, usually see when children are brought into the hospital, whenever they just see a white coat or even someone putting on a white color, they start crying, because they know they're going to be hurt, they're going to be traumatized, and they're going to feel pain. So creating a friendly environment is also something so important. And that's why you see, like, most of the time in the wards, you usually have pictorials, and you also have, like, the nurses are usually recommended to put on, like, uniforms that are colorful and looks playful, so that you just don't traumatize the baby. The other thing, you just need to be confident and calm, and you be loving and caring. You just treat these children like they were your own, because remember, there's someone looking at you, the parent, and they're like depending on you. Because for them, whenever their child is sick, especially those who are very sick, they're like, some of them usually feel like as if they all depend on you. There's nothing they can do about this. Yeah. So you just have to make them feel like everything is going to be okay. And you just have to put yourself vulnerable like that, like you're going to help them. Because most of the time, I usually see some people who just, maybe the mother, for the mothers, they're usually so desperate, and even whenever the baby starts convulsing or even having fevers, they're so scared. So you can't just come there and be treating them like they should know everything is going to be okay. For them, like, whenever the baby has fever or such kind of thing, they don't feel like everything is just going to be okay. They start getting traumatized. Maybe they saw another baby passing away just an hour ago, so they feel like maybe the baby can be the next. So you have to be able to accommodate them, even if they feel like they're complaining for like petty things. You just have to accommodate them. Just don't let it be like you're treating other adult people, because for the adult ones, you can just try and at times ignore, and they'll just take it and understand. But remember, for the kids and for their mothers, they're vulnerable. Just accommodate them with whichever way they react. The other thing is that in pediatric ward, you need to be alert and sober and focused, because remember, in an adult, even if you forget and give a higher dose, maybe the body can accommodate that. But remember, this is a 2-month-old baby. You just can't be making any mistake and trying to come to job when you're not sober, when we are so sleepy and you are not concentrating. You're going to really affect this baby. So you need to be alert, you need to be focused, and you need to know what you are doing. Another thing is that you need to be good with your calculations. There's so much calculations of the medications you are giving, and whenever you just do a wrong calculation, then you're giving a wrong dose. So you have to be good with your calculations. And then the other important thing is maintaining hygiene. Remember, most of these kids usually come with infections, especially, let's say, the GE kind of infections. So whenever you are dealing with one child and you're dealing with the next one without washing your hands, without maintaining a safety technique, you'll be busy trying to contaminate the other babies. So you should just have the highest level of hygiene. Washing your hands, just keeping everything clean is just so important in the pediatric ward. When it comes to even giving the medications, when you just have, I usually see some people until I just feel like, oh God, you are treating another baby, you're even touching their blood or something like that. After that, you are already touching another baby, and for this, the other previous baby was even having diarrhea. I do just feel like there's too much contamination in that ward. So that thing, hygiene, is something that should be mainly attained in the pediatric ward. And the last thing that you require is to be patient. Remember, you are dealing with smaller kids, and at times they usually take longer than the older ones, and so you just can't expect them to take a shorter time. Maybe it's 10 days and they're still there. You just can't say, no, I'm not giving the medication, I've been giving this medication for 10 days and now we want to stop. That can't happen with the smaller kids. You know, for us in Kenya, like, so many people are just so ignorant with such kind of things like giving medication. You just can't be assuming anything. So you just have to be patient with them, just be there for them, be ready to help them. Like, yes, they'll call you for any issue. You think that it's a small issue, but you know the mothers are always right. Like, they're the ones who have stayed with these kids the longest than you, so they can't call you and tell you like there's something wrong with my baby, and you're assuming and telling them that you are going to be okay, just leave that. I don't know what kind of things. Please, I don't know, but people should just try and be patient with their mothers and be helpful. Just when you go to pediatric ward, you just have to be ready to do what you're doing. Just give you all yourself to do what you're doing. You can be ignorant as you want in other adult wards, but just don't do it in pediatric ward, because for the adults, at times, even when you're ignorant, they can try and do it for themselves but not for the kids. So that's a little bit of my experience and what I'd like to tell someone who wants to be in pediatric ward. And yes, it's a good place to be, and it's a nice place to be, a place that I'd like to work for long. So if you are new to pediatric ward or you want to be a pediatric nurse, I wish you all the best. And thank you so much for watching this video. See you on my next video. Bye bye.